Hello, my name is Josh Condren and I am a BSN student at Southwest Baptist University. Today I'm going to be discussing central line associated bloodstream infections, otherwise known as CLABSI, and whether or not increasing the frequency of central line care reduces the rate of CLABSI. The reason I chose to discuss CLABSI is because it is highly prevalent in the ICU setting, which is the unit in which I work. Almost all patients in the ICU setting receive a central line at some point in their care, which increases the risk for a central line associated bloodstream infection to occur. CLABSI are also very costly too. Estimates of the costs attributed to CLABSI range from $5,000 to $22,000, almost $23,000 per CLABSI. The costs associated with CLABSI are up to $2.3 billion annually. CLABSI also lengthens the hospitalization stay. Patients who require treatment as a result of a CLABSI will have their hospital stay extended by an average of 2 to 5 days. CLABSI also result in a reasonably high mortality rate. Estimated 28,000 deaths in intensive care settings occur yearly due to CLABSI infections. My Peacock question was for adult patients from the age of 19 to 64 years of age, does increasing central line dressing changes to twice a week compared to once per week decrease the amount of CLABSI if done correctly and as a sterile procedure over a 6-month period? My population was age of 19 to 64 years old. My intervention was increasing the central line dressing changes to twice a week, and that was in comparison to the once per week intervention. The outcome would be to decrease the amount of CLABSI, and the time frame would be over a 6-month period. Although my Peacock question was directly related to the dressing changes, it was a little bit difficult finding articles that were directly related to dressing changes themselves. So instead, I went for articles that were related to increasing the amount of care required for central line dressing changes in order to provide the same outcome of decreased CLABSI rates. For my database, I chose to use CINAHL for all the articles that I found, as it yielded the best search results. My search terms were CLABSI, adult, central line, and infection prevention, which yielded a total of 240 articles. I then narrowed that search by selecting full text so that I could get all the necessary information needed. I then narrowed it more by selecting the publication years from 2014 to 2019 in order to provide the most current information from the last 5 years. I also narrowed it with geographic location of the United States so that the information would be pertinent to our healthcare system. And I followed that by narrowing the age population from 19 to 64 years of age to target the general adult population without getting into the elderly population. The first article I chose to use was titled Up for the Challenge. This research study was done to determine if using alcohol-impregnated port protectors along with chlorhexidine gluconate barrier dressings on central lines would decrease the rate of CLABSI. In this study, 100 central lines were inserted at Lehigh Valley Health System from July 2011 to July 2013 for a total of 1,705 line days in the patients. The PICC team at the facility evaluated the effects of an antimicrobial PICC device in an effort to see if using these devices would decrease the number of CLABSI. There was a significant decrease in the number of CLABSI that occurred with the use of the new devices. There was no occurrences of CLABSI in this trial after 1,705 line days. The second study I chose to use was titled Standardizing Central Venous Catheter Care by Using Observations from Patients with Cancer. In this study, they did an initiative for central lines rather than a research study, and it interviewed patients in an attempt to figure out variances in central line care from patient to patient and nurse to nurse in order to come up with a solution to possible issues that might arise. In this study, 45 patients at the Cancer Institute were interviewed about the type of line, the duration of use, problems encountered, and observations about variation in central line care. It asked patients to characterize differences between line care at home and in the clinic, and precautions taken when showering or bathing at home. It also asked patients to describe how they were educated about the care of their central line and to assess its adequacy. The patients then rated their confidence in caring for the line and their knowledge about what to do if the dressings became wet or loose, and they were asked to describe signs of infection. These results were also classified by age, gender, insurance, and primary diagnosis. Although this study wasn't necessarily data that would be directly used for its research numbers, it can be concluded that there is a variance in care of central lines from patient to patient and nurse to nurse, which could be a good indicator of how infection could occur, as well as good areas that we could improve upon as nurses. This study concludes that eliciting patients' observations about their own care is very valuable. Many patients are astute observers of their care, and nurses can learn from their observations. The third study I chose to use was titled The Influence of an Antimicrobial Peripherally Inserted Central Catheter on Central Line Associated Bloodstream Infections in a Hospital Environment. This study was done to see if the effect of using an antimicrobial peripherally inserted catheter would have an effect on the incidence of CLABSI. The study included approximately 260 patients each in both the non-intervention and intervention groups. The participants in the study consisted of adult hospitalized patients requiring insertion of a single or double lumen PICC. Patients in the non-intervention group included adult hospitalized patients who received an unprotected single or dual lumen PICC during a 6-month period, or 180 days, between August 2010 and February 2011. Patients in the intervention group included adult hospitalized patients who had the study antimicrobial PICC placed during a 6-month period between August 2011 and February 2012. There were 8 CLABSIs in the group that did not use the intervention, and only 1 CLABSI found in the intervention group that used the antimicrobial central line. Therefore, this did in fact decrease the amount of CLABSI when using the antimicrobial lines. The fourth article I chose was one done by a rural hospital that implemented the Society for Healthcare Epidemiology of American guidelines to decrease central line infections. The purpose of this article was to review the CLABSI rates and examination of the prevention strategies following implementation of the SHEA guidelines. The sample consisted of 76 patients meeting inclusion criteria between July 2007 and June 2010. The sample was divided over 3 time periods: 27 in the first time period, 27 in the second time period, and 24 patients in the third time period. The CLABSI rate per 1,000 days was 1.9 in period 1, 1.7 in period 2, and 1.3 in period 3. The sample ranged in age from 26 weeks to 91 years, with 61% of the total being male. The CVC line types included triple lumen catheters, hemodialysis catheters, implanted ports, umbilical catheters, and pulmonary artery catheters. The insertion sites included subclavian, internal jugular, femoral, brachial, upper chest, and umbilical. CLABSI rates showed a downward trend across the 3 time periods. Interventions were introduced at each time period to correct deficiencies. Currently, CLABSI rates at this facility remain lower than the baseline of 2.4 for calendar year 2013, 2014, and 2015. The final study I chose was central venous catheter protective connector caps reducing intraluminal catheter-related infection. This study was done to determine if using catheter protective caps saturated in alcohol in all the ports of central lines will decrease the rate of CLABSI. 2 ICUs had all the CVC and IV tubing, needleless connectors covered with a protective cap. This study was done as a non-randomized prospective trial occurring March 1, 2011 through February 29, 2012. No randomization was attempted, the premise being that during the study period, the patient mix would be comparable with the patient mix seen during the 3 previous years. The outcomes measure was the CLABSI rate. The implementation of the port protector cap system resulted in lower infection rates compared with an alcohol swab technique. Our results indicate that consistent use of the caps in tandem with strict compliance does influence CLABSI rates in a positive way. The similarities between these articles were that all of these studies were done in an attempt to improve CLABSI rates, otherwise lowering them. They were also all quasi-experimental studies, which is an experimental research design in which individuals are not randomly assigned to groups, but rather the researcher manipulates the independent variable and implements specific controls to augment the internal validity of the outcome. All of these studies were also articles that included alternate therapies to already existing procedures. In other words, they were trying to improve upon a procedure that was already in place. Also, all of these articles yielded positive outcomes or less CLABSI. Some of the inconsistencies with these articles included that they were all quasi-experimental designs, or otherwise they were not randomized, which decreases the validity of the articles. Also, all of these articles were small population sizes, with the largest of these being 257 participants. I feel that if there were more participants in these articles, it would have increased the validity of the data collected. These were also all self-reported data studies, which could lead to skewed numbers by the researchers. Some of the gaps and limitations that I came across in researching this topic were that there were few studies over central line dressings themselves, but rather over other interventions that decreased CLABSI. There was also limited patients fitting the criteria that these researchers were requiring for their tests, which yielded smaller population sizes. Inconsistent data collection was something that I witnessed across the board, as everyone seemed to collect their data in a different fashion, which could result in varied results. There was also many patients who refused to participate in studies as they didn't want to be part of the study itself, resulting in, again, smaller population sizes. In conclusion, there is definitely enough evidence from these research studies to support the fact that change could benefit our patients in regards to decreased CLABSI rates. There is also a lot of room for improvement based off these research studies, as all of them yielded decreased CLABSI rates from what we are currently doing in order to take care of central lines. Although there is evidence that supports change, there's not really enough evidence to overrule current guidelines, as all the data that was collected in these studies was done in a different fashion. Therefore, you can't really compare each study to each other because the data wasn't collected in the same way. That being said, I do feel like there's a lot of room for improvement when it comes to decreasing CLABSI rates, and I predict that in the future, the rate of CLABSI will decrease in time.